Hello, my name is Pfeiffer. I'm a dietetic intern, and today we're going to be talking about chronic kidney disease, also known as CKD. Chronic kidney disease, or CKD, is when the kidneys start to lose their filtering function. The kidneys have 1.3 million filters inside of them, also known as glomerulus. These glomerulus filter out waste products from the blood. When the kidneys are damaged, the filtration rate of the glomerulus decreases. This is known as the glomerular filtration rate, or GFR for short. Your doctor may tell you about the GFR and determine what stage of kidney disease you have based on that rate. Anything below 60 is considered moderate to severe kidney disease. And these are stages 3, 4, and 5, or end-stage renal disease. When talking to your doctor, they might mention waste products from CKD such as BUN, sodium, potassium, or phosphorus. These products are nutritionally related and can be managed with a good diet. If these are not managed, complications can arise. Some side effects can be nausea, loss of appetite, vomiting, and tiredness. Lowering sodium in your diet can help limit the stress on your kidneys. Choosing less packaged, processed, or canned foods can help lower the sodium in your diet. If you're going to choose any of those foods, make sure to check the label and check for something that is lower in sodium. If you want a guideline for choosing sodium, the National Kidney Foundation recommends 1,500 to 2,300 milligrams of sodium a day. Limiting potassium is also important in a CKD diet. If potassium builds up, you can get something called hyperkalemia, which is dangerous for the body. Potassium is found in all food groups, so bringing a list to the grocery store with high potassium and low potassium foods can be very helpful for choosing the right foods. Common foods with potassium are going to be avocados, tomatoes, bananas, potatoes, oranges, and cooked spinach. Another nutrient to limit is going to be phosphorus. Phosphorus is found in dark sodas, processed foods, processed meats, such as deli meats or cured meats, as well as some nuts and seeds. Our last nutrient is going to be protein. Protein contributes to your BUN, or blood urea nitrogen. Because it contributes to your BUN, you want to make sure you're having a moderate amount, or half the palm size of your hand. This is about 3 to 4 ounces of protein. For more information about CKD, go ahead and visit the National Kidney Foundation or talk to your registered dietitian. Now that we learned about all the 4 nutrients that we should be limiting or watching in our diet, let's recap. First, we learned that we should be limiting our sodium in our diet. For limiting sodium, we want to make sure that we're choosing less processed, packaged, or canned foods. For our potassium, we know that it's in a lot of foods, so we're going to take a list of high and low potassium foods to the grocery store when purchasing. We want to avoid foods such as avocados, tomatoes, potatoes, spinach, and bananas. There's many other foods on that list, so make sure you're taking a look at it and checking it twice, like Santa. For phosphorus, we want to make sure that we're choosing less processed foods, less sodas, dark sodas, and processed meats. And then for our protein, we want to make sure we're having lean protein, about 3 to 4 ounces or half of our palm. Thank you for watching and have a good day.